नमस्ते स्टूडेंट, खुश रहो वीडियो। आई JV'n डॉक्टर नरेंद्र सिंह शेखावत, असिस्टेंट प्रोफेसर डिपार्टमेंट ऑफ शल्य तंत्र, फैकल्टी ऑफ आयुर्वेदिक साइंस, ज्योति विद्यापीठ यूनिवर्सिटी जयपुर। In previous class, we discussed about initial part of anatomy of urethra. In today's class, we will discuss our rest part of anatomy of urethra. As you can see in this picture, there are two part of male urethra: posterior or proximal urethra, anterior or distal urethra. Now let's start the proximal urethra. There are three parts of proximal urethra: pre-prostatic part, and membranous part. Let's begin with pre-prostatic part. 1 to 1.5 centimeter in length, extend vertically from bladder neck to prostate, surrounded by proximal internal urethral sphincter, made up of smooth muscles bundle. Function of internal urethral sphincter: maintains the urinary continence, prevents retrograde flow of seminal ejaculate into bladder. Applied, this part can be damaged by bladder neck surgery. Transurethral resection of prostate. So, retrograde ejaculation semen occur in such patient may lead to infertility. In this picture, as you can see, the pre-prostatic part of male urethra. Now, second part, prostatic part of proximal urethra. 3 to 4 centimeter in length. It passes through the substance of prostate. Posterior wall of this part present urethral crest and prostatic sinus, and veromontum is called collicus seminis. Urethral crest, midline is mucosal fold. Prostatic sinus depression on both sides of crest. Prostatic ducts open in sinus. Elevation of urethral crest. Prostatic ureticle open here. Ejaculated at open here. Prostatic uterus small blind sac develops from mesonephric ducts or urogenital sinus, homologous to vagina of female. Also vaginal masculine. Ejaculated duct vasa difference plus duct of seminal vesicle. In this picture, as you can see the coronal section of the urethral system and structures around structures. In this picture, as you can see all the structure of sagittal section. A picture is sagittal section, lower picture is coronal section. Third part is membranous part. Shortest part 1.5 centimeter long. Second most narrow part. Most narrow part is external urethral orifice. Passes through perineal membrane. Surrounded by distal external urethral sphincter. Has voluntary control. Maintains urinary continence. Made up of urethral smooth muscles, urethral striated muscles, urethral part of liver any muscles. Now, second part is anterior urethra or distal urethra. It extends from membranous urethra to external urethral orifice. First part is bulbar urethra. Lies in the bulbosponginous of penis. Widest part of urethra. Bulbourethral glands open in it. Finale is line corpus spongiosum. It Its terminal part is dilated in glans penis. It's called navicula fossa. Numerous urethral glands open in it. In this picture, left side, as you can see, the urinary bladder and urethra male. Sphincter of urethra. There are two types of sphincter: internal urethral sphincter, and external urethral sphincter. Internal is involuntary. It's surrounded internal urethral orifice and pre-prostatic urethra. Second, external urethral sphincter is voluntary, surrounds membranous urethra. Arterial supply. Urethral artery, branch of internal pudendal artery. Dorsal artery of penis, branches of internal pudendal artery. Venous drainage in anterior urethra, drained by dorsal vein of penis into internal pudendal vein, drain into prostatic venous plexus. Posterior urethra, drained by prostatic and vesical venous plexus, it drain into internal iliac veins. So, student, this is all about the anatomy of structure of urethra, especially male urethra. This session is powered by digital version 2.0 Jayoti Vidyapeeth Women's University, Jaipur. I hope you are satisfied with this digital session. If you have any doubts and queries, please mention in comments box. I will resolve it soon. Thank you, students. So, video.